Today, we're going to find out what makes Comprehensive Dental Center the best dental practice in the area. Dr. Winchester, it's great to be here today. Thank you so much for having us.
Well, thank you. It's very nice to have you here too.
Yes, let's first talk about the name change, Comprehensive Dental Center.
Well, basically, we've been the family dental center for over 25 years. And, you know, people would always call us, you know, do you do general dentistry? Yes. Do you do cosmetic dentistry? Yes. Do you do extractions, root canals? Well, yes, we do all phases of dentistry. And with the changes in dentistry to more of a, what's called evidence-based dentistry or medicine, we felt that the name Comprehensive Dental Center best described our practice. We are interested in the total health of the patient, to provide them with services still in the family atmosphere, but basically with all the changes that have occurred in dentistry, we felt that the name was a better choice for what we are doing today. What we found is our patients really don't like to be referred out. You know, they don't want to, you know, you go to one doctor and they say, okay, we got to send you to this specialist for this, or go to this specialist for this. So we've gone for additional training in order to treat our patients for as many possible conditions as we can do. One of the services that we do provide is with our head and neck cancer screening. We use the Identify 3000. This is a light system which uses different frequencies of light, and by using this different frequencies of light, I can actually detect cancer at an earlier stage than I could with my naked eye. Basically, one of the other things that we do besides checking for cavities is we use a bacterial test called Caries Free. And what this test does is it actually identifies the bacteria in the mouth which causes decay. Now, why is that different? Why is it important? In the past, I always, you know, patient has a cavity. What do? We put a filling mat. That doesn't take care of the infection. It doesn't take care of the bacteria. With this test, we can identify where the person's likely to get decay in the future. And by treating this infection as an infection, we can actually give medicine. And by giving medicine, we can pretty well stop the decay process in the mouth. One of the other things we always check for is for gum disease. Gum disease, I like to tell people that if your gums are bleeding, you have a problem. Gums do not normally bleed. And why is this important? If your gums are bleeding, you are causing heart disease, you are causing strokes, you are basically potentiating or making diabetes harder to control if you have that, low birth weight babies, a lot of scary things with gum disease.
Yes.
And so it's very important to monitor the gums and to treat them if there's an active infection. The biggest problem with gum disease is it doesn't hurt.
Right.
Most people don't know it until they go to the dentist. So this is, again, another thing that annually we check the gums with our pre-care assessment appointments, and of course when you first come in to see us. Our patients, when they ask for a service, we do our best to provide that service. This year, one of the best things we've done is we've learned to do oral sedation dentistry, and it is fantastic. A fearful patient can basically get through their dental appointment and be very comfortable. It also works for people who need longer appointments. Right. You know, some people don't want to come to the dentist and have multiple appointments. They just want everything done in one appointment. And if that's the case, oral sedation is also a good choice for them.
Right.
Another reason to use sedation, there are some people who just have a hard time getting numb, and this actually helps to numb them. TMJ team involves, you know, if your teeth are being worn down, breaking teeth, involves headaches, migraines, earaches, facial pain or jaw pain. All these are different symptoms of some TMJ type problems. For the most part, a person can have problems and not have any pain, or they can be in the other end of the spectrum and have a great deal of pain. I don't want to get too specific in technical as far as what we do, but
Sure.
basically our goal is that we want people to be pain-free.
Right.
If we can get them pain-free, then at that point we have different options, and patients have different choices in how they want their mouth treated. And that way we can either keep them pain-free or stop them from wearing or breaking teeth.
That kind of goes hand in hand with the sleep apnea. 'Cause
Correct.
I wouldn't think of coming to my dentist if I'm, just tired all the time or just not feeling up to par.
As a dentist, I can't diagnose sleep apnea, but I can screen for it and get you directed to the sleep physician for the diagnosis. With sleep apnea, the best treatment is what's called a CPAP machine.
Right.
Now with mild sleep apnea, you can use a dental appliance.
When we said you do just about everything, we were not joking. It's kind of one-stop shopping. Comprehensive Dental Center, the name says it all. For experienced professional dental care, bring the whole family. I'm Darley Collins for Crystal Coast Now.